Yay, we're live and we are 6 minutes early. Look at us. Look at us, little early birds. So we're starting with something that is off topic today for us, but it's relevant because it's been showing up in our comments, which is some of the negative attitudes towards psychiatry. Now, these are not founded on nothing. There are reasons that there have been some negative attitudes towards psychiatry, but hey, Jerry, welcome. But I will let Dr. Dom talk about why there have been some negative attitudes towards psychiatry.
Yeah, look, we definitely get it more than any other medical specialty and probably any other doctors. And it makes sense because we're working in an area that already has a lot of stigma and fear and is really badly understood by the public. And we're working in an area where we don't have the same kind of levels of evidence. You know, I often kind of, talk to people about my, one of my best friends and Hannah's mum is a gastroenterologist. They know everything about the liver. They know every single process that goes on in the liver. And then I come across, we don't even know what our drugs do in the brain. We've got a little bit of
wild.
And so we're really dealing with very different levels of evidence, much more based on clinical kind of experiences than looking at an X-ray or a blood test. But let's also look at the history because there is no doubt that there have been some really major human abuses occur in the name of psychiatry. And Hannah and I were talking about it before we came on. One of the things when you look back through some of, quite a few of them, some were just plain evil, but a lot of them were where people went in with good intent. And the word asylum, when institutions, the big psychiatric institutions were kind of set up in the 1800s, the idea was of providing asylum for, at that stage they didn't have medication, they didn't have any treatment. People who were psychotic or in, really highly distressed emotional states, they didn't have any way of relieving their distress. And they looked at the idea of, well, maybe, provide places where they're not, not kind of, they're able to have peace and quiet and not have to meet all those societal expectations. They were often in the country. Idea, they'd be more comfortable in nature.
It sounds nice on paper.
So nice on paper.
It sounds nice on paper.
And then, of course, over time, they became an increasing place of, used to kind of like it all degraded.
Oh, we've already got comments coming in. So let's start with comments. Let's start with Ralph. How did we get into our heads that there are intrusive thoughts? Well, there are intrusive thoughts.
Yes.
What do you think? Comments on intrusive thoughts, Dom?
Yeah, look, there's we have different qualities to different thoughts. And one of the things we started talking about mindfulness, and I'll try to keep remembering to bring it in because it's so core to any management of mental health. Because it's about that capacity to observe your experience, really observe our thoughts. And there are certain thoughts that come in, they feel differently in the way that they come into your mind.
Can you describe what an intrusive thought might be or what it is? What is an intrusive, what does it mean to have an intrusive thought?
It's more the way that they come in. So they're going to have more force to them. They're going to take over your awareness as versus be part of the flow of connected thoughts. Often they might not be directly related. Now, we often use the word intrusive thoughts, so critical consciousness. This is the critical, voice that people will talk about. They're nearly always derogatory. They're the ones that tell you how stupid you are or why did you do that? Or
have you ever had if with an incinerator and you're like, why don't I just stick my hand in that incinerator?
That's an intrusive thought.
I would never stick my hand in an incinerator, but for 1 second, my brain's like, stick your hand in the incinerator.
If you experience intrusive thoughts, that's the kind of thing that you can actually have come up. People with fully blown OCD, but also people who've got a vulnerability to that, they will describe the distressing nature of thoughts that do not fit with what their conscious flow was. They might be violent, they're not they just don't fit. So yes, they are very real, and the first step is by being able to identify and understand them. I can pick the tone of mine now. And it's taken a long time.
Do you experience intrusive thoughts regularly?
But they've dropped off a lot ever since I've been able to I catch the tone. That tone is not one that's it's helpful for me to work with the content of.
I don't think I've had an intrusive thought for a long time.
Yeah, I get them very much nowadays. It's, am I hungry? Am I tired? Have I been outside?
So you're connecting with your interoception and biological. Yeah. I don't think intrusive thoughts are something I've experienced in a long time.
So,
hey Tay, thank you so much for joining in. As always, usual rules, drop any questions you have in the comments. We'll answer them in order. And we can't give any personalized medical advice, so we just discuss generally. But we started off by talking about the fact that we have received some negative comments on our videos about psychiatry. So we're just kind of going through the history of psychiatry and how there's been some terrible things done in the name of studying psychiatry. I mean, in the name of medicine in general, there have been some atrocities committed, and we have to acknowledge it.
And how do we learn from them? One of the things we do now is
obsessive religious
very
common. Really?
Yes, very much.
Why is that, do you think?
We call them ego dystonic, so a certain type of obsessional thoughts. They're almost the exact opposite of what a person where their value system actually lies.
Hey, Foxy.
And this one's really probably important to if we're talking about decreasing stigma, because these are the ones that people really dread sharing with anyone. They dread sharing it even with a mental health professional.
And while we're here, I just want to say that this is a shame-free space.
Yes.
This is a space where there is no shame. You can share anything. You can say anything. No one's being shamed for nothing.
Absolutely.
Yeah.
And, so violent thoughts, sexual thoughts, religious thoughts are really commonly come in that group. And people kind of feel, look, if I tell somebody I'm having these thoughts, they'll think that's actually who
I actually think that.
But as soon as we actually, they're almost diagnostic in the fact that they are the opposite to what that, and the person has such intense distress associated with those thoughts. But getting back, so, one of the things I saw right at the beginning as well is, do we cure mental health? One of the areas that we don't really get cures in the work that I'm doing. And look, I often again look at some of the other specialties where they've got that sense of, yes, we have cured this. But when we're dealing with mental health, it is such a combination of mental health, not just all about psychiatry. It's also
across
about
your
the environment.
lifetime.
It's about the society. A lot of the conditions that we're dealing with, there's a vulnerability, a biological vulnerability.
Can we look at Stacey's question? Any help with a 7-year-old struggling with number 2 on the toilet? Doctor is just medication. Oh, Stacey, I feel your pain.
Yes.
I have an almost 7-year-old who is refusing to go to the toilet, being a little gremlin about it.
And as soon as they start refusing, this one's just such a big spiral because they don't want to go because it's painful or difficult.
Eden, I'll write that down.
And then they get even more blocked up. This is an area that is very, very common at that age. The doctor might be looking at the medication point of view because that's actually, it's often without some medication input. If it's already kind of gotten into that really secondary area, it's pretty hard to get managed without some medication. But definitely looking at the allied health people who there will be people who specialise just in child toileting. And there's a whole heap that the physios and the OTs have got to say about this area. And programs and ways, and this is about
I watch a lot of YouTube videos.
Once you start talking about,
I put YouTube videos on for my son.
Kids, yes, whatever. There's so many different techniques that you can make it. Sometimes it is about I'm just something else. Use something else in the loo. I've just lost that one.
That's all right.
Yeah.
But you will get
it's
there.
It's a very common one that kids will have problems with. Interestingly
Dealing
enough,
with it now.
one of the ones I'm aware of is where kids, where it can start where they don't want to go to the toilet at school. And that's always worth exploring as to why might it be that they're not that keen. Sometimes it can be that not enough privacy. Sometimes it can be that the toilets are stinky.
Can we jump to Eden's question? I have trouble eating around people and people are convincing me I do it for attention. This is sounding very it's personal medical advice we can't give, but I think when people are having trouble eating in public, sounds like disordered eating.
And one of the things I'm just kind of thinking as I saw that question is one of the great things that psychiatry can bring and looking at working with mental health is it's immediate. The thing that immediately came up for me is why, interested, curious. I wonder what's going on, rather than kind of like, and there is this a lot of things that people experience will have people around them just go to, you're just doing it for attention. It's really unusual for people to do, it is actually so much less common than people think. Kids don't do things for attention. Adults generally don't do it for attention as well. There can be all sorts of reasons why it's hard to eat around other people. It's actually quite a common one.
Yeah.
And is underestimated.
And if you're neurodivergent, it's even more common. Can we look at Elisa's comment? I'm worried my mental health has affected my kids 5 and 7. I see a psych next week for ADHD and OCD. So the first thing I want to say to you is that if you are worried about if you're a good parent or not, you are a good parent.
Absolutely.
Yeah, you're a good parent. Bad parents don't sit around and wonder, am I a good parent? If you're worrying about it, you're a good parent.
Absolutely. The fact that you care, the fact that you're concerned.
Yeah, exactly.
And it's if you there's some great parenting advice, information out there at the moment. None of the people who I kind of have found really helpful, they're not giving advice. They're giving information. They're giving explanations. They're looking at the science behind parenting. But one that I do follow a lot at the moment is Good Inside. Becky Sharp, she's looking at the idea that no kids are bad inside. It doesn't make any sense. And she very much looks at the idea that any behaviour is related to a lack of skills. But she's got an app, and at the moment when I open that app, the first thing it says is it's never too late.
Yeah, it's never too late, and I'm so glad you're seeking help.
Yes.
And I'm so glad you're thinking about your kids. You're doing all the right things.
And a lot of people they look at the parenting things and they kind of go, oh, they're telling me if I didn't do that at 5, I've wrecked my kid for life. Not true.
Shenanigans.
Wonderfully,
can we go to
neuroplastic brains?
Yes. And neuroplasticity extends past the age of 5.
Anytime.
Can we go to Niaf's question? I was diagnosed with BPD, but I think I've been untreated for ADHD or autism. How likely is that? We can't give personal medical advice, but it is hugely misdiagnosed. There's a lot of cross-diagnoses between ADHD, autism, BPD, CPTSD, so entirely very possible. I'm just going to keep scrolling. My almost 5-year-old with ASD level 2 won't use the toilet because it's too boring. I bribe my son and give him an iPad and say you can have 30 minutes on the iPad if you sit on the toilet. That's what I do. It's bribery. Yeah. You're so welcome. Florence, my mother hates me. I'm really sorry to hear that. She left me when I was 17 to live her life, and even she doesn't love my kids. Thank you for sharing.
Yes.
That's a very brave thing to share and say.
And it's one of those really deep wounds where the mother hasn't been able to provide, what children need. And I think, what's so relevant in what you've said there is that it wasn't just you.
Yeah.
You're now able to
You're not the problem.
You're able to see that she didn't have the capacity. She doesn't have the capacity with your kids. And that one's particularly difficult because then you're watching the impact it has on your kids.
Thank you for
but
the
you're
support,
there for
everyone.
them. You're there for them, and you can actually make it. And look, kids need to, kids respond so well to frank information. Yes, there are some adults that just aren't very good at relating to kids.
Yeah. And it's okay to say, Nana, or however you refer to your biological mother, she's not really good with these relationships.
Yep.
Unfortunately, we wish that she was better, but she isn't. But I love you and I am here, and you are more than enough for these children.
Yes, and there are no bad kids. So when a parent has gotten into the situation where they're making their child feel hated, that is their problem.
It's never you. It's never the child's fault.
Yes.
Sorry, I'm leaning in because I'm like a blind person. Is intuitive guanfacine normal to have for a month before a stimulant med like Vyvanse, normal dose?
Guanfacine is a medication that we are seeing a lot more use of now. It's a non-stimulant, and it is a medication that you take every day, so it's working constantly in the background. One of the issues with stimulants, they're only working when they're in your system, so you've got 8 hours of them,
I'll write
and then
that
they're
down.
gone. We are using them a lot in combination nowadays, and particularly me personally, I'm using it a lot where I've got, when I'm working with somebody who's got both autism and ADHD, because they often have a quite different response to the stimulants. Which one you put in first? The guanfacine, there's a couple of things about it. It does
vacation.
take a little bit of time.
We've got an episode. We've got a series on narcissism.
Yeah, it takes a little bit of time to get onto because it actually works in a way that also affects the system that regulates blood pressure. And as long as we work with it carefully, it doesn't tend to cause problems, but we do go up very slowly, and the dose give your brain a chance to get used to it.
I just want to move forward to Autistic Gamer's question. Is there a way to unmask after getting diagnosed? Because we talk a lot about this. We use the word camouflaging.
Yes.
Unmasking feels negative. I don't like it. Rari, I've written your question down. We have discussed narcissism. So, Dom, do you want to talk about unmasking or camouflaging? And I'll write some of these questions down.
So we've talked quite a bit, and we're very happy to keep talking about it because it's such a big area and it's such a big part of adapting after diagnosis. I was literally just a few minutes before we came on, Hannah and I were talking about something related to autism, and we were both sitting there going, yeah, but isn't that normal? And then it's
Isn't that normal?
Apparently neurotypical people don't do it that way. And
I'm always surprised.
It's that idea of when we've just experienced something a particular way all our life, we see it as normal. And it's a real part of the after a diagnosis, a really helpful thing is to get to know. It's same for every single human, regardless of your brain. Get to know your brain. How does your brain do particular things?
What do you like? What do you love?
Where does it work really well? When does it really struggle?
What lights it up?
I tried to drive to Hannah's today and realised that I'd forgotten my car.
She started walking down the driveway.
I had to explain that when I arrived and tried to say that.
Our company does not do testing and diagnosis. We're really about social cohesion and education. Sorry, guys. I just wanted to throw that out there. But get to know your brain, what you love. In the past,
I totally would have been beating myself up, or probably kind of like, how on earth did I? Now, I was definitely very curious. And I know where I was and how, that my brain was so occupied with a few other really important things.
Stacey.
But so the first thing is getting to know your own mind. A big part about reducing camouflaging is seeing about what it was doing. So it's where there's a sense that the neurotypical way is the right and correct and only way to do things, and that you have to pretend or bring that in. And as you get to know your mind, you can start to really work with, well, no, this works for me, and it might not be the majority way, but it's okay to do this. However, we've talked about this a fair bit as well. The reality is about 90% neurotypical, 10% neurodiverse. We are a minority. And that if any time that you're in a culture where
Tyson, we'll go through some examples of autism.
It is actually adaptive. It is important to be able to, relate across to that 90%. But the big difference is it coming from a place of shame? There's something wrong with me and I have to pretend to be something else. Or is it coming from a place of self-acceptance? I'm pretty happy with the way my brain does things. Not always easy, but it is my brain and it's not going to change.
I think we need to move forward to some other questions because we had one
so
from
many coming
Rari
up. Yay,
again.
thank you, everyone.
She's BPD with kids that are neurodiverse. We've got ASD and ADHD.
Yep.
Worried about handling the household. Should she get tested? If your children are both neurodiverse and you've been diagnosed with BPD, we can't give personal medical advice, but there is often misdiagnoses and there is a genetic link between neurodiversity. So I would keep that in mind.
But what we can also talk about is co-regulation, because any of the people who are working with new paradigms in parenting at the moment, it's all about co-regulating. Now, one of the really cool things about a lot of the new parenting approaches is, and it comes up in all of them, reparenting, is that be able to parent your kid in the way that you're wanting to. Often it actually involves doing some internal reparenting as well.
It does.
And but that's actually a really good opportunity because when you're motivated and really care and want to change things and do things differently with your kids, it's that motivation to change it for yourself as well. So in learning to co-regulate your kids' emotions, you're learning to regulate your own as well. There's all sorts of really cool skills that
you're retraining yourself while you're learning about your children and their needs, and it's actually really, really amazing. I'm going to go to compassionate care. Actually, no, sorry. I'm going to go to Tyson, who wants to know what are some examples of autism? Well,
that's a huge
question. A big one would be struggling with transition between one task to another, loving routine, really good pattern recognition for many of us. Interoception is huge, struggles with interoception. Some autistic people can hear electricity in the walls, which is very fascinating.
And that's the interoception and then the sensory sensitivities.
Lizzie, I'm so sorry, we don't do diagnosis. Dr. Dom is a psychiatrist, but she isn't taking new patients. This is about education and community building and making a safe space for everyone to ask questions.
So autism, so the repetitive behaviours, so that's where...
Oh, Rari, I'm so glad that you're feeling
it's
good.
It's a big one that we talk about. And
yes, stimming's great.
Yes, and then the social aspects of it.
Cass, yes. Okay. If all four of your children have ADHD or ASD, statistically, it's very likely that...
We are getting a huge component of assessment and diagnosis in this area at the moment is my kid got diagnosed.
That's how I got diagnosed.
Everyone is saying I need to have a look at this as well. From the point of view, is it worth having a diagnosis? It does make a huge difference to understand your neurotype. It's just...
Miss Invisible, get tested if you can.
It is so easy to spend a lot of time trying to change things that you're doing, but if it's hardwired, then all it's doing is making you feel defeated and feeling like a failure.
Can we answer Angie's question?
Yep. Because
I love Angie so much. Interoception and snacking. How do I work out why I snack uncontrollably sometimes?
I've told you guys I've been going through this workshop and this came up literally just the last time I was on.
No, if you can hear electricity in the walls, you're not going crazy, baby. There's a lot of autistic people hearing electricity in the walls.
Yes, it's actually more common than people think. So with interoception, it's the capacity to be aware of what different signals are. And if you think about it, hunger...
Alicia, I'll write that down.
The feeling that you get when you're hungry and lonely are very closely related. And it can actually be really difficult, to differentiate between if the signals are coming up, I'm hungry, they can feel very similar to I'm lonely.
That's fascinating.
The other one is anxiety. So anxiety, it's the actual biological process of anxiety affects our
Adam, I'll write that down,
sensation.
neurodiversity info.
Because the whole idea is, that you don't want to be running away from the saber-toothed tiger with a big full stomach. And so sometimes it's about kind of like, am I hungry, or am I full, or am I feeling full because I'm feeling anxious? So once you get interested and curious with, am I mixing up these sensations and not bringing any, I should know the difference. Well, no, they're actually really similar.
Yeah, and it's actually really hard. Sometimes I feel empty after eating a big meal. Yeah, again, you may have confused your interoception there.
Another one that's actually really common in people with autism.
Anxiety related?
Is not registering when they're full and being able to, these things, the more we know about
Cosmic
them
Gemini,
and
I'll write that
share
down.
the information, people can kind of go, okay, that's just the way my brain works. Then you can bring in different signals. Okay, how do I know how much I've eaten? It's likely that I am full at this point.
Okay, we're going to go back to Alicia's question because she had a question. She's diagnosed with BPD and she wants to know how to handle the swings. Also has trauma and I think ASD or ADHD. So thoughts on BPD, handling swings. What would we say?
Look, this is such a big area when we come into learning emotional regulation because it involves,
Alicia,
if we actually,
autism, got you.
Yeah, if we, and those three are often diagnosed together. So basically we're just starting to really kind of work into this area at the moment.
Chris, can you kick blood out?
Is first of all interested and curious. For a lot of people who struggle with big swings in emotions, it's where there's not the interoceptive awareness of the build-up to that emotional state. For a lot of people with autism and anyone who's got kids with autism, they will be, I'm fine, nothing's wrong at all, full meltdown. And it's once a person is in a full meltdown, if they're in an emotional overwhelmed state, a lot of things are not going to work at that time. And that's where a lot of the psychological and the self-help strategies can be really frustrating because people go, look, I'm trying all these things I'm told to do. I'm trying to do the breathing. I'm trying to do this. Nothing's working. It's because you've only become aware at a point in which those things are no longer going to work. So it's very much about learning to identify earlier.
Oh, hey guys, sorry to have extra hosts. Yeah, thank you. Sorry, we're not doing extra hosts right now, but
and helps answer
we
that
will
question.
in the future. Adam had a question about being neurodivergent. Is there a link between neurodivergence and fibromyalgia?
I'm not completely across the research in this area, but it would not surprise me at all. There is a very clear
Cosmic
link
Gemini, you're next.
between trauma and fibromyalgia,
Oh,
and there's
Stewie,
a very,
that's so
very clear
kind.
link between neurodivergence and trauma and developing trauma physiology. So just fibromyalgia is one of those ones that has had a lot of stigma in the past.
Yep.
It's a condition that's really distressing where people get a lot of pain associated with it, but there's not that organic, identifiable from an investigations perspective cause for the pain.
Chris.
But we're now becoming so much more aware of these conditions. Functional is what we call them, where we haven't, it's not that they're all in the mind. They're very much the mind and the body are connected, and where stress and trauma is related, they're both involved.
Can we go to Cosmic Gemini who asked about tics?
Yes.
I don't know what causes them. What causes tics?
At the moment, we're looking at two really big areas related to tics. One
I'm
which
writing that
is
down.
the neurological, and the most common, one that people will be aware of in the name there is Tourette's, where there is actually a very clear neurological cause for the tics. But we are currently seeing a lot more tics that are related to functional neurological disorders. They're actually called TikTok tics.
Which is interesting.
Yes.
That they're called TikTok tics.
And just a word on this, we were talking before about emotional contagion.
Oh, Mia.
People kind of, they're when we talk about things like TikTok tics, it's where
I'm going to write that down, Mia.
And initially people can go, oh, well, they're just pretending or they're just mimicking or whatever else. No, we're so much more understanding the actual biological underpinnings and the reasons why humans have evolved the capacity to feel other people's feelings or to have emotional contagion. It's very well understood, and it's it explains a lot of times where there's apparent contagion of functional conditions.
Yeah.
It's not just people pretending because they've seen it on TikTok.
So, Stewie a while back, how do I support my autistic friend?
Oh, wow. Thank you for asking.
That is such a beautiful question.
Absolutely.
And I just love it so much.
Ask them.
Yeah. Ask them. What are they like? What are they into? They're your friend.
Yes. They will, if they're working on really understanding their own autism, and depending on, I know that the mind is a special interest for me. I can talk about it infinitely, but absolutely don't feel concerned about asking them. We did a workshop with teenagers.
Safe foods are important.
We started talking to them about how they can help their autistic friends, and one of them put up their hand and said, "Can't I just go and ask them what they want?" And we were there going, "Oh my goodness,
yes, you can.
Yes, you're actually correct on this one."
We were bold to host a seminar for a group of teenagers,
and we are incredibly grateful for everything.
Mia, we're going to talk about that as well. I just want to answer Nat's question, who's saying she's in functional freeze.
Yes.
She feels like she's been in functional freeze for 6 years.
Yes.
With PTSD.
Absolutely.
Comments on how to get out of functional freeze and dealing with PTSD.
Yep. So there's a lot of different treatments out there at the moment to help the nervous system reset.
Angie, yes, the earlier intervention you get for autistic children, the better.
Absolutely.
Yep.
So functional freeze, first thing is to identify that that's what's happening. It is your autonomic nervous system is set
shooting star.
At a chronic place of it's not safe. And the it's not safe needs to shift both on a psychological level. We need the brain to become aware. Grounding, I know, it can sound very simple, but part of grounding is very much that looking around in the environment and not kind of going, brain, don't be so stupid, there's nothing unsafe here, why are you reacting? It's much more, I understand, brain, that you're still stuck in the past, but let's have a look around and see if we can come back up into the present. That self-talk is so important. The brain won't listen if you're being mean to it.
Yeah. Be kind to your brain.
Yes.
That's our whole name, NeuroKind. Please be kind to your brain.
Yeah. The other thing that to be aware of if you've been in functional freeze long term is you're probably going to go back through fight and flight before you return back to baseline.
Yeah, fighter Angie, get that NDIS funding, get your son some help.
So that can be really confusing to people. They come out of freeze and they think, okay, I'm going to feel normal again. No, you will actually often go into that fight flight. So you come out into a hyper kind of, I want to punch someone, I want to run, I want to. That's your system clearing that energy.
Now, can we talk directly to Mia, who's left a few little comments?
Okay.
Mia is struggling with a lot of healing. I think Mia is having a really rough time.
Okay.
So,
well, we're sorry to hear that, and thank you for sharing.
Thank you for sharing.
Space to do that.
Yes, absolutely, it is. And if you were my sister and you were having a rough time, I would tell you, one, please rest. Please rest as much as you're able to. Please sleep. Please be kind to your brain. Please be kind to your body. Please listen to the kind things that are said to you. Please take them in. Please reject the negative thoughts that your brain sends your way. Those aren't real. That's not real. Please be very gentle with yourself. Please rest.
And just seeing Hannah's written down about that you're starting healing. And
she wants to start healing and she wants to know how.
Oh, wow. Just the very first thing is setting that intent.
Yeah.
And
that's the first step.
Inviting that in. And then,
compassionate care.
It's dropping expectations. Gosh, there's a lot out there about what healing looks like and what people should be doing to heal and what they're not doing.
It's different for everyone.
It's absolutely different for everyone. If we want to talk about
thank you so much for the support,
the fundamental
guys.
first step, whether it's trauma that you're healing, whatever you're healing from, whether it's coming to terms with a neurodivergence diagnosis, it all comes back to looking at it through a mindful lens. And mindful lens is looking at it interested, curious. Okay, I wonder. One of the things I will just say, just on the whole beginning a healing journey, is I have learnt through 20 years of experience of supporting and being, being with people through that, is that you actually have that inner wisdom and your system knows somewhere inside exactly what the steps are and what order they need to occur in. And some of the biggest mistakes I've made in the past is trying to kind of, oh, you need this now.
Alicia, we won't probably speak about epilepsy because that would be a neurologist.
Yeah, sorry, that's right outside of it. Often coexistent, but it's not an area.
Yeah,
that I have the experience in.
An interesting question from Compassionate Care is: if you have ADHD, is it common to feel overwhelmed and scattered when dealing with all the healthcare forms? Yes.
Oh my
goodness.
I
hate a form. I hate a form like I hate the devil.
Do they write them just to torture us?
They're trying to torture the neurodivergents by making us fill out forms.
One of my diagnostic things that I see is when somebody comes in with their forms and they haven't actually kind of circled any
write
of the
that
rating,
down, avoidance
but they've got
anxiety.
little comments next to each question as to what was wrong with the question, and I hear you.
I hate forms.
Forms in general, why don't they just say what they really want? But
just let me tick a box, yes or no.
From the point of view of if you're getting a lot of most neurodivergence diagnoses do come with a lot of forms. Try not to put too much pressure on yourself. It's not about having them completely accurate. We're looking for patterns.
Autistic gamer, it happens. I have offended many neurotypicals inadvertently.
Oh, yes.
Oh, yes. Any neurodivergent knows that we are upsetting neurotypicals, but we're like, why?
Yeah.
I thought you wanted to know that. You didn't want it. You didn't want to know that.
They're always the worst for me, where I think I'm actually kind of like in the right space and then you've just gotten it so completely wrong.
I hope you have a lovely day, Mia, and please be kind to yourself. Can we do
between ADHD and trauma response? This one is so difficult.
And then I'll go back to Shah's question, but yep.
So it's bringing in that interested, curious. There's a lot of similarities and there is a lot of overlap. So you're wanting to kind of check out is just, a general way of thinking about it can be the ADHD experience is much more in your brain. I can't get my brain to think, I can't get my brain to stay on topic. If your attention is being affected by a trauma response, you're going to have the physiology as well. I'm tense in my body, I'm frozen, or I can't sit still because I want to run away. But they interrelate a lot as well.
We had a question from Shah a while back, avoidance anxiety. What do we deal with? How do we deal with avoidance anxiety? And then I'll do Alicia, trauma anxiety.
Are we avoiding due to anxiety?
I think the question was...
Sorry, I didn't see the question.
Was avoiding things due to anxiety.
Yeah, okay. So we've talked a bit about this one again, and I'll just... It's such
EMDR,
a helpful tool. Window of tolerance. So what this looks at is the idea that if you are in an uncomfortable emotional state, whether it's anxiety, whether it's trauma, hyperarousal, if you avoid
Alicia, I'm just writing your question
due to that
down.
Anxiety, it will get worse and the avoidance will get greater and greater and it will gradually narrow down your window of tolerance. You can get to the point where you're either avoiding or you're in overwhelm as soon as you don't avoid. So we're wanting to gradually increase. What's the window of tolerance? That's the area where you're doing something that makes you uncomfortable, but there's growth. Your brain's learning that it's uncomfortable but not harmful. And within that window of tolerance, you might just be a little bit uncomfortable or you might be really close to overwhelm. And the more you get to know the where you're at in the window of tolerance, the more you can work out when avoidance is appropriate versus when it's not going to be helpful.
Okay, how to get grief when you still somehow have created a place where the person exists? Please help. Could you reword that question? Just because I'm a little confused by it. Do we want to do, hi, I'm 54. I think I've always had ADHD, but I've never been diagnosed. When a GP is allowed to diagnose? Now in Queensland.
And I think they just went to Victoria this week, but I'm not
that's great
on that one.
That's amazing.
It is an evolving situation, though. It was a little bit sprung on the GPs, so there wasn't a lot of communication about that change, and a lot of GPs are still doing a lot of very important, they're working out where they feel safe and comfortable in working with this area and making sure they've got the expertise to do it safely.
Alicia, we're going to answer you next, but we're just going to start with Shooting Star. How do you know if you have ADHD?
Oh, gosh. Where do you begin? Why are you wondering about it? So when you kind of sit there and go, if you're wondering about it, then what are the things that are going on in the world around you that make you think that?
So sorry.
Not getting to appointments, not remembering.
Are you always late? Do you have time blindness? Do you struggle? Do you procrastinate to do things?
What does your room look like? And what happens when you try to complete tasks?
Yeah. Do you start a task and finish it, or do you start a task and leave it?
So many different areas where you can have a look around. And once you bring in that interested, curious lens, you will start to see it if it's there. If you're doing that really interested, oh, gosh, did I really just forget that, that plate was there, or that I was halfway through doing that?
Incidental accidents. Do you have a lot of, do you personally injure yourself a lot by accident?
Yes.
I do. Where's my latest bruise? Oh, I must have faded off my arm, but I'm always bruised. I walk into things a lot. Alicia, I'm just going to jump to where we are at.
Yep.
I have a 4-year-old and I have a strong feeling she could have ADHD. She very well might.
We are diagnosing...
me not even getting dressed and having an appointment in 20 minutes. Real. Now, we don't give personal medical advice, but if you are in Queensland or Victoria, you can get diagnoses and medication and
through GPs.
Yeah, through GPs. Yeah.
From the point of view of children and ADHD, there's and this is not my area of specialty. I work primarily with adults, but I am the parent of a kid with ADHD.
Yes.
And I know that the paediatricians and the child psychiatrists are diagnosing much earlier than they used to in the past, and are much more comfortable using medication earlier. There used to be that real, and it's not easy. It is not easy to take, the idea of starting your child on medication.
It's so much pressure, and there's also a lot of tinkering back and forward with medication.
But it's also very much looking at the risk of especially young children missing big developmental stages. If they go into school and can't make friends or don't learn to do those basics in their reading and writing in that first couple of years, that's going to be very, very hard to catch up on.
So the earlier that you can start interventional therapy, the better. Please, do whatever you can. How do I know the difference between BPD, AU ADHD, and ADHD? There's so many overlaps.
Yes.
There is so many overlaps. It's really hard. It's really hard for psychiatrists. They're working at it. They're doing their best.
In lots of ways, DBT
Shooting
works for all
Star,
of them.
I'm so sorry.
So and when we're working with people who might have combination diagnoses, we're going to be looking at, well, what experiences or functional difficulties are we going to be targeting? If somebody's got really big mood swings, we're going to be working with mood stabilizers regardless of the diagnosis.
Oh, Renee, I'll write that down.
A lot of the therapies now, they're across all of those diagnoses.
Can we go to Renee's question about addiction therapy? I'm struggling to find the right therapist. I've dealt with substance abuse and gone to therapy. I ended up seeing my GP every single week to deal with it, and she was incredible. Basically, she was just my therapist every single week. I see her every second week now. She just knows she's stuck with me for life. So thank you for sharing that. We also want to destigmatize addiction. It's an illness.
Big thing with addiction is it a primary addiction? So for some people, their brains definitely have that vulnerability where they have that high likelihood of getting a biological addiction to substances. A big group, though, that we're going to be seeing who have substance issues with not misusing substances is going to be where they're medicating, self-medicating. So a big part
Alcohol.
of it's having a look, are there underlying conditions that the substance is being used to either manage the condition or to manage the secondary distress associated with it.
Well, with me, I mean, I'm happy to say that I went through a really difficult phase in my life and was drinking far, far, far too much.
Very, very common in, especially with late diagnosis neurodiversity.
Yeah.
But there is also very real and quite well understood now biological pathways that contribute to why some people have that vulnerability to getting addicted. Yes.
Yeah.
No shame.
So, yeah, no shame. And so while I wasn't diagnosed as like an addict, they just said, well, you're abusing a substance. I now do have a drink from time to time if I want to. So that's where I'm at. Would ADHD realistically be helped much on guanfacine or need to introduce stimulants for procrastination?
Very variable depending on the individual. So for some people, we might be using a non-stimulant. For some people, we might just be using a stimulant. For some people, we're going to use a combination. And there's, it's a very individual approach for each person. But it's not necessary that the stimulants are the only things that we can use if procrastination is a big part of what's going on. I was watching a really awesome podcast yesterday about rejection sensitivity dysphoria and ADHD.
Rejection sensitivity. I want to talk about this so much. Can I just say, Renee, unfortunately, no, you can't get appointments with us, but we will be starting a podcast soon so that you can get to know us a lot better, and we'll talk about things in much more depth. So hopefully we can answer more of your questions. But rejection sensitivity
dysphoria. So it's
just so huge.
And it's so misunderstood. And it is intense and severe and very real. And, the podcaster was interviewing the person who actually coined the term, the psychiatrist. And, he said basically once it's been set off, all you can do is ride it through until
Renee, it's really
the brain
hard.
kind of shifts on. And it's very, very much about prevention. But why I'm coming to procrastination is that RSD actually occurs, you actually have rejection sensitivity to your own internal rejection.
Wow.
So if you try to do a task and there is a part of you saying that if it's not good enough, I am going to reject you, you're not going to start that task.
Oh my God.
Now, procrastination, anybody who kind of is going to have big inner critic response, if they don't get things perfect, they're going to be reluctant to start. But if you're going to get a big bout of rejection sensitivity dysphoria that's going to put you out of action for a day or two, you are really not going to start that task. So that one I just took away and went, that makes so much sense.
It does. If you're like, oh my God, I'm going to suck at this.
Because I'm going to really reject my
my task
identity.
Paralysis is just sometimes, oh my God. ADHD is glorified trauma. It's a debate. Thoughts? I do not believe that. I believe ADHD is
attentional.
A neurotype.
Attentional difficulties are a symptom. They're an endpoint that can occur for all sorts of different reasons. It is almost universal to have attentional difficulties if you've got a trauma-related condition. ADHD is the term we use very specifically for the neurodevelopmental disorder. We've got fMRI scans that show the difference in circuitry in the brain where ADHD is present. So probably what's much more of an issue is getting accurate diagnoses.
Can I tell everyone to go follow Chris, because he's the Wizard of Oz behind what we're doing,
and he's making sure that we can focus on people who we're hopefully we can really, be giving and supporting
to people who actually need it instead of just spamming.
Don't get distracted by the negative. So thank you.
What can long-term extreme apathy long-term mean? What can long-term extreme apathy mean?
So apathy is a really interesting word because it's not just fatigue, it's not just low
reactive
energy,
attachment
it's really
disorder.
got that
Cosmic, I'll write that down.
Lack of motivation. And yeah, it can mean it's again like attention. It's the end stage experience of a lot of different conditions. So it's very much about being interested and curious. When
you'll hear us say this over and over again.
It works. Basically, those words are the instruction to your brain to step back into a mindful place. And the more that you kind of go, am I approaching this interest? It's just a switch. It's kind of saying to your brain, oh, we want to look at this from that mode. But if you're really apathetic, you're wanting to kind of have a look, do I feel pleasure? Do I feel motivation? What are the things that push me into doing things?
Can we talk about Cosmic's question? She's been diagnosed with reactive attachment disorder, but she's still not really sure what that means. Can you explain reactive attachment disorder?
I would have to, there's a lot of technology in the area of attachment at the moment, and I'm not quite sure what that one would be referring to. So we've got different types of attachment styles that relate to how we biologically connected to our child, our main caregiver as a baby. And there's either secure attachment, which is the biologically stable one, and
disorganized attachment.
There's disorganized attachment. There's anxious attachment. There's avoidant attachment. Are the three really big areas. This one's been getting a lot of attention recently because it absolutely.
Emily, will come to you next.
If there's differences in those areas, it will affect how you relate as an adult. And we've got a lot more effective. In the past, it was a difficult one to access in therapy, but we've got a lot more ways of understanding it with anything that's going on. If you're able to approach with compassion and kind of go, okay, yeah, look, it's understandable right now. The way we talk about attachment stuff now is so much healthier.
Please approach everything with compassion, guys. Yeah. Please approach yourselves and everyone else with compassion. Emily, I want to talk about Emily's question because it plays so much into what we're talking about, co-regulation.
Oh, yes. Okay.
How to help my son's big meltdowns at night since being back at school. We both have ADHD.
And this one you probably already know this, kids will, they regulate, they're working so hard, they're holding it all together at school. And
Neptune, unfortunately, we can't give personal medical advice. I'm so sorry. They get to that point where they're tired, they're just about ready to go to bed. And it all pours out at that point. From the point of view of managing meltdowns, co-regulation. So this is where actively and deliberately bring yourself into a state of physiological calm. You keep coming back to, I understand that this is not deliberate. Noticing all this, we all get he's doing this to annoy me, or I can't cope with all of the different things that are going to come up. It's really distressing. Sorry, Cosmic.
But the more that we can shift away from that and into I can help right now by co-regulating, by staying calm myself. And then it's very much looking at what are the particular things that work for individual kids.
And we were also talking about the fact that co-regulation is often really difficult because two neurodiverse people can regulate in very different ways. Yeah. So it can be really hard to regulate your child if you regulate in a different way.
And for some people who are neurodivergent, literally the connections in the insula, which are the part of the brain that actually enable co-regulation, might be different. And
Shooting Star, this is your family now. Welcome to NeuroKind.
I was also reading something really interesting yesterday. It's amazing how often you look at something and then you look at what's going on around you and go, oh, my goodness, that makes so much sense. And that's the idea that kids with ADHD, so a lot of parenting advice will be about you start your bedtime routine, you want to go calm
bath time.
Beforehand.
So we're going to do a bath and then we're going to do this.
Them regulate. And for people whose kids have got ADHD, they might experience that the calm starts and then, and my child last night was
Sassy Queen. We'll talk about science for ADD.
Great delight, jumping up and down and breaking an absolutely massive box. Oh, he was just having an absolute ball. But there's, what I was reading about was that for particularly kids with ADHD, they actually need to discharge that energy just before they go to bed, so that they're going to be able to sleep. So all the calming is all really fine, except the energy is still all there inside and has to come out.
Can you answer Sassy Queen's question about what are the signs of ADD? And I'm going to write down a few others. Hayley, writing yours down now.
So did we specifically looking at ADD versus ADHD?
Let's just do general signs that would be appearing, I think.
Yeah, so it's an attentional, it affects capacity to maintain attention on whether it's a task that you're trying to do, whether it's a conversation that you're having, whether it's looking at what's going on internally. So that's the absolute core feature, is that difficulty maintaining attention.
Hi, Sienna. So glad to see you, Emily.
And that's holding attention on what you're choosing to have it, not having your, in ADHD, people will describe our attention gets pulled across, whether it's by an interesting thought or by something in my environment.
Emily, I like being alone and I hate being touched. So I get it. I'm also a married woman, so I don't know how that works, but Dr. Dom said that when she was in boarding school, after a day at school, she would go under a blanket for an hour.
Yep.
Just to be alone.
Yeah, I had no
we
idea
want to be left alone. Leave us alone.
Yeah. Again, knowing what works for you, we actually, it's very, very few people do not need any social connection. There are some people, they absolutely exist.
But most of us need it.
Most of us need some. So what it is then about is working out what is the level that you need and what's the nature of it.
Exactly. What works for you?
Maybe not.
Can we answer Hayley's question? How to help control anger from ADHD?
And are people with ADHD more prone to irritability and anger? I don't exactly know the research, but I was hearing something about that yesterday. And it would make a lot of sense because particularly if there's that hyperactive, that high attention and activity. One of the issues with ADHD is being able to, and emotional regulation, it takes attention to regulate emotions. Basically, to regulate an emotion, you need to become aware of the signs within you that show that you're having the emotion, identify what it is, and then choose a regulation strategy.
It is hard to deal with.
And it actually takes a lot of attention and concentration. But the more you get good at picking early signs and catching it early, being aware of what are the things that are likely to set off and where your brain is more sensitive to things than another. So for some people with ADHD, it can be really tricky because they're going to get angry about things that wouldn't make another person angry.
Can we have a question from someone who is saying they hate getting wet? It's a sensory disturbance. They hate it.
Yep.
Real.
Yeah.
Lots of autistic people are like showering. No. Oh, I hate it. But I personally love it.
Yeah.
I don't love showering. I love bathing. Put me in a bath every night, but a shower.
Being in the pool can be. So one of the things we talk a lot about sensory sensitivities. People who are neurodivergent.
Hayley, I'll write that down.
They will often have they're able to use sensory soothing more effectively as well. So it's kind of like there will be some things that are highly irritating and distressing, but there will be some things that are actually
it's really hard, Emmy.
Calming.
It's really hard.
I was thinking about your little guy the other day because they were, I was hearing someone talk about the pool and how for some autistic
my son
kids,
loves
that
the water.
Being under the water is just so soothing and calming.
Yeah, my son loves the water.
Trampolining, that being
and he loves trampolining. Yeah.
Both of them can be really sensory soothing. They're also helping with proprioception and vestibular interoception.
Like trampolining's like the best OT. taking the kids to bounce.
Yeah.
It's absolutely amazing.
It was funny, I've talked before, I got diagnosed with something at 14, which would now be called...
Are you comfortable saying
autism,
what that is? Because I want to talk about it.
It was called minimal brain damage, but...
Minimal brain damage. Does this look like a woman with minimal brain damage?
But nowadays, it's very much understood that, that term's far more likely to relate to an autistic neurotype. But
she had autism.
The main thing
She's
that was
autistic.
recommended was trampolining. And at the time, I'm sitting there going, what's trampolining going to do? I love it. It had always been a place that I really enjoyed.
Jane's here. Hi, Jane. Thank you so much for dropping in.
Which is your awareness of where you and your body is in space, and vestibular, which is the balance side of things. Both love trampolining.
Renee, I don't have a touch of the tism. I got all of the tism. Haley, actually, can we go to Renee's? How to connect to people, struggling to connect to people, because this is rampant. This is rampant in our society at the moment.
Absolutely.
Everyone is so isolated. It's not getting better. So what would you say about connecting to other people?
So be real about, we are in a really, there is so much social disconnection at the moment. And so then you can kind of be going, it's not just me, it's everybody's in this situation. And then have a look at what connections you are most craving and needing and how accessible they are. And if you can do it in the real world, you're going to, it's one of those things. It's like eating, you can, after a really good meal, then that's going to keep you satisfied for a long time. Going out and actually having in-person social interactions.
Yeah.
Social media does fulfill a certain level of
it does,
connection.
Yeah.
But actually in person has a much, much greater effect.
Jane, yes. My dog has been a great way to connect with people. He gets out and about. Heck yes. Walking your dog.
What does it say about humans and social connection at the moment that we nearly all find it much easier to connect to dogs? Dog parks, if you go... I
love my dog park.
And we all love the dog parks. I don't know the names of any of the people at the dog park. I know the dog's name. I know the dog's names.
Absolutely. The people's names, I'm like, you're irrelevant. I need to pat this dachshund.
One of the things I was reading recently was that...
Good for you, gamer.
It is worth knowing that our brains have got some kind of...
animals, I love them all.
Our brains do some wonderful things, but they've also got some areas where they don't necessarily give us accurate information. It turns out in social things we've got certain areas that we will misread.
Haley, we will speak on anxiety, We'll talk more about that.
And we're far more likely to think the other person is not appreciating the social connection, but have a think about how much most of us are craving it at the moment. It's likely other people are craving it as well.
I say my dog is my best friend.
Yeah.
I love that dog.
So being aware of the self-talk that
Can we talk about anxiety?
Yep. What about?
So anxiety depends how you experience it. If we're talking panic attacks, we're talking racing heart, we're talking sympathetic nervous system going up, hyperventilation, racing heart, feeling like you can't breathe or you're struggling to breathe, anxiety in general.
Okay. I'd like to actually just, if we go from social connection, let's go across the anxiety related with socialising.
Yeah, because that's huge.
The biggest part of it is actually it's anticipatory anxiety.
I get that.
So anticipatory anxiety is one of our
I've thrown up as well.
Human states, because we have all the physiology, we've got all that kind of increased energy and apprehension, but we don't have the balance to it. So when we're thinking and anticipating an experience, our brain is actually more prone to think about all the negative side. Once we're actually in the experience, even if there's things that are unpleasant,
it's completely
also
different.
things that are pleasant. It's a whole mix of things happening at once.
Oh, your palms get sweaty. Weirdly, I never get sweaty palms.
Oh, look, everyone's got their thing that helps them know when that system's up. But anticipatory anxiety, once you can identify it and be aware of it, it makes it much easier to have a look at, am I getting accurate information right now? Am I going to feel much better when I do the thing that I'm anticipating? Or can I at least move towards doing it and see what happens?
Yep.
So, yes.
We'll just keep going for a little bit just because we've got a few more questions.
And just the other thing on anticipatory anxiety, when you're actually really pleasurably anticipating an event, what do you feel?
When you're
really looking forward to something, what do you feel? You feel tense in your body, your heart rate's up. They're actually exactly the same physiological sensations.
Yeah, sorry, they just blocked us off for a second because they were saying we'd been inactive even though we haven't. TikTok's just being silly with us at the moment.
So it's always worth checking in if you've got anticipatory anxiety. Am I actually having a reaction to something that I'm anticipating in a good way? The feelings can be very difficult to tell apart.
Like I have this exact thing.
You're going on a holiday. You've got all that excited energy.
Yeah, but I'm like excited but anxious about it. But it's a good thing. It's a very bizarre experience. But I get you. And just so that everyone knows, a lot of the comments that you say are things that Dr. Dom or I have experienced. None of you are alone. I'm sure many of the people in the comments who read them have also experienced. Can I bring up, I was taught to have a meltdown box.
Oh, cool. So things
What's that?
It's look, different things. Sometimes it's literally actual physical things that are going to help you that you can just easily reach for when it's hard to think about it, or a mental toolbox.
Yeah, Chris, you better rest after this. You work so damn hard.
Yeah, so absolutely. It's creating when you're calm or, you're not in that state, really thinking what are the things that are going to help me and what can I grab easily, whether it's a mental tool or an actual physical kind of fidget or sensory input.
You can see that because, so I don't have my long nails at the moment, which is killing me. So I've had to fidget with the pen the whole time.
We've both got our pens going. Here we go.
We've both got our pen.
There we go.
Even if you can't see me, I'm stimming at any time. My favorite is cricketing in bed where I rub my feet together. It's the best. After 6 years now, recently CPTSD, I had anxiety before I got PTSD. I am showing signs of ADHD. Again, these things, comorbidities, misdiagnoses.
There's a lot of research going on.
Mother and daughter. No, we're not mother and daughter.
I actually sit in between. So Hannah's mum, I've known Hannah since she was a baby because her mum's one of my best friends. But generationally, I'm an X and you're a millennial, aren't you?
I'm a millennial.
Yeah, so I'm Gen X. So we're actually kind of that in between.
Yeah.
But
Dom's best friends with my mum, so she's known me since I was a baby.
Yeah.
And now here we are. So for now, after 6 years now with that anxiety, yep.
So people with neurodivergence, both ADHD and autism, there's a lot of research going at the moment.
So much love to you.
Is that there is a higher rate of trauma. So people with neurodivergence are more likely to experience trauma. Definitely the impact of, PTSD, part of what could often happen is where there's been lots of micro trauma and then one big trauma and then it actually sets off to being a disorder. But there's there's research being done at the moment. We know that brains are different in neurodivergence, but we think the autonomic nervous system, which is the thing that causes, that's most disordered in PTSD, may also be different. Big coexistence.
There's a lot of evidence that it might be different. Yeah. Generational trauma is crazy. Yeah.
Oh yeah.
Oh yeah.
And the fact that we're at least recognising it now, thank goodness. But
yeah, absolutely.
It really is that one where the person who recognises it is the one who has to do all the healing for all those generations.
I know, and it's so unfair.
It is totally unfair, but it's also the only way.
Yeah.
And the difference for the generations ahead.
Yeah.
Fingers crossed.
It is hard, but you've got this.
Yeah.
Guys, we've just hit our 12:02, so we'll probably jump off soon. If anybody has, Bonnie, you are doing a great job. Stop telling yourself you're not doing a great job. You are.
Bonnie, I actually misread that when I saw that, and I thought you actually said that's me and I think I'm doing a great job.
Yeah.
That's what I read. So
you are doing a great job.
My brain literally deleted the negative.
You are doing a great job.
Yeah. Anyone who is identifying intergenerational trauma exists and making any attempt in changing it are doing a good job.
Nat, that's so normal. She's saying after my SAN physical assault at work, I haven't been able to even still touch hug.
Yep.
Totally normal. Don't push it. Don't push yourself. Be gentle with yourself, kind with yourself.
Listening to your body.
Listen to your body. Keep yourself safe. I'm so sorry that happened to you.
Yes.
That's not fair. Life is not fair. You did not deserve that. You're not responsible for that. You are not responsible for someone else's bad behavior. And take all the time in the world that you need to heal.
Yep. And there's every reason to think as that healing occurs, hugging will come back for you.
Absolutely.
In the right time.
There's a lot of hope.
In the right time.
But don't rush yourself.
Yeah.
There's a lot of hope.
Lots of self-compassion.
Exactly. Linda, I saw that comment and I'm so sorry that you've had to make those decisions.
And gosh, anniversaries don't get any ease. You know,
No.
People are often surprised how much anniversaries do bring things
That's great,
up.
Nat.
It's an
Thank you.
opportunity for your system to honour those feelings.
That's a really nice way to say it. It's an opportunity for your system to honour those feelings.
Yeah.
Yeah. So we will clock off now. Oh, recently started experiencing anxiety. Anxiety is the worst. It is the absolute worst.
No, it's not. It's a natural process. It's a really important part of keeping us.
Every week I complain about anxiety, and every week Dom's like, it is your brain trying to keep you safe. And I'm like, I will stab you with this pen.
I call it gritted teeth mindfulness.
Gritted teeth mindfulness.
I really want to hate this anxiety, but I'm going to recognise it as being my amygdala trying to keep me safe. Gritted teeth mindfulness.
The amygdala is my little lizard brain. Chop it out. Sorry, we're getting silly now. Now we're getting silly.
Okay.
Because it's the end of the live, so now we're just getting silly.
Did we do this last week as well? I think
yeah.
Yep.
Because our brains kind of clock out at about 50, 55 minutes, and so we get silly. And we just start talking nonsense. It's what happens.
But thank you to everyone who's asked questions.
You guys
if
have
we
been
don't
amazing.
Get to your question, we do go back and have a look at them.
Oh, a psychiatric registrar from
Great.
WA. Good
Glad
for
to have
you.
And we're really grateful for all of your questions. And
we're just so grateful you're here.
we do go back and have a look at the ones that we haven't answered and try to come back to them.
Yes.
So, yeah.
And any questions, drop them in the comments of our videos, and then we can make video responses to you as well.
Yes.
You are all amazing. You're all kind, good, decent people. Treat yourselves that way this week and treat other people that way this week.
Okay. Thank you.
Oh, Renee, that is so... Gosh, you're going to make me cry. You probably saved lives today. Kiss, kiss, kiss. You did. You're an angel. And be kind to yourself, please. Be kind to yourself and other people.
Thank you.
Have an amazing day, everybody. We'll see you next week, same time, same day.
Yes.